Good evening, everyone. Thank you so much for joining us on this wet fall evening. I'm Elizabeth, the Office Manager for Spinal Diagnostics, and welcome to Alternative Treatments for Pain webinar. This is going to be presented by Dr. Jason Anderson, and it's brought to you by Spinal Diagnostics and in partnership with Boston Scientific. Again, thank you so much for taking time out of your evening. There's a couple things to know about this webinar before we begin. So you can feel free to submit any Q&A questions at the end or throughout the webinar, but please submit them in the Q&A section and not the chat, just because that remains anonymous for you and HIPAA. If you want to do it in the chat, you're more than welcome, but just so if you want to stay anonymous, stay in the Q&A if you have questions. We're going to try and get to as many as we possibly can this evening, but we also want to be mindful of your time, and we may have to cut some of that short. So there's some options for that we'll talk about at the end of the webinar if we aren't able to get to everyone's questions. Also, this will be recorded, so if something interrupts you this evening and you can't watch the entire thing, you will be able to watch a recording later, or you can always share this with family members or friends that you think might be interested, and it will be posted on our website. Well, I guess that covers all the details. So Dr. Anderson, it's all yours.
Thanks, Liz. Thank you, everybody, for showing up tonight and watching this recording. I see many familiar names on the list, including some people I saw earlier today, and then some new names and faces. So tonight, we're going to talk about a variety of different treatment options that you may or may not have heard of before. And hopefully we can explain a little bit further about what each one has to offer for different chronic pain conditions. Next slide. So again, we're going to learn about chronic pain treatments and what option may work best for your situation if you do have chronic pain. And then items that you can even bring up with your pain doctor at your next office visit. Next slide. So we know chronic pain is painful, obviously, but the real problems start to impact, or one of the issues that it happens is that it impacts how you're able to function. And sometimes these can be very devastating, especially if you have certain things that you need to do or you want to do and you're not able to do because of your pain. Next slide. The normal treatment algorithm for anybody that presents with new pain usually starts with medications, then progresses to physical therapy if medications aren't helping. Most pain resolves within 2 weeks, and 80% of pain that doesn't resolve within 2 weeks resolves within 2 months. So a lot of the physical therapy and the medications initially is just trying to get you through that time period. If that pain continues, then patients often get transferred to a clinic like ours to manage their pain with injections or trying TENS units or medications that are a bit stronger. At worst, some patients may have already tried drug pumps or surgical interventions or many different types of injections and nerve blocks. Next slide. So when we're looking at different types of chronic pain, we usually think of whether the pain is mechanical or neuropathic. Neuropathic pain is pain that's generated from the nerve itself. It's chronic, thinking like diabetic peripheral neuropathy, which results in a lot of burning, pins and needles, stabbing, numbness, weakness in the feet, and then progressively goes up the legs, and then even can impact the hands and move up from there. Or you could have neuropathic pain from a prior surgeries, chronic nerve injury type situation. A mechanical pain is distinguished because it usually happens while you're in one position, or when you particularly do one thing or another thing, it always comes on. So for instance, standing and walking always brings on your pain, but when you sit, you get relief. That's an example of a mechanical type pain pattern. Next slide. So tonight we're going to talk about 3 different options for chronic pain. First is radiofrequency ablation, then we're going to talk about indirect decompression, and then spinal cord stimulation. Next slide. So radiofrequency ablation procedure has been around for quite some time. It's been around at least 30 or 40 years. And it's used to treat joint pain in the low back, for that chronic low back pain that might happen, or neck pain. Usually it manifests with the worst pain first thing in the morning, and you have associated stiffness with it. And then as you do some activities, that pain eases up a little bit. And then in the evening, when you start slowing down, the muscles get cold, things tighten up again, and it can get painful. A lot of patients describe having pain with that first few steps. That's usually joint pain related, and it's often pain in the low back related to the joints in the low back, but you can also have it in the neck related to either age-related changes there, or from whiplash type injuries from car accidents or falls. What we typically do to treat that is what are called medial branch blocks, or diagnostic blocks. We do that on 2 different occasions, prove that that particular joint is your pain generator, and then we go in and do a third procedure, which is the treatment, and it's called radiofrequency ablation. And what we do for that is apply a small amount of heat to a very small area, in a very safe area, and quote unquote burn the nerves so they can't transmit pain signals. Now those nerves will die off, but they also tend to grow back. You get anywhere from 6 months to 18 months of relief on average. And then when the nerves grow back, we can just repeat the procedure and again give relief for 6 months to 18 months. What's nice about the procedure is you're not ending up with a spine fusion, which is what they used to do for this procedure. Spine fusions usually ended up not always taking care of the pain. And when they did take care of the pain, that usually led to problems at the level right above or below the fusion. So this has been a nice way to kind of control how the spine responds to the pain going forward. Next slide. So the next, I want to talk about a more new procedure, I would say, at least in the pain management realm, and that is called the Vertiflex procedure. It's an indirect decompression system. Next slide. Patients that are great candidates for this position, or for this procedure, typically have pain when they stand and walk. They might get numbness and tingling in their legs, or they might get weird sensations in their legs. But when they lean on something like a shopping cart or on a counter or use a walker, they get relief. Or when they sit down, they get relief, or lay down, get relief. And this is an example of a mechanical type pain issue. Basically, what's happening is patients are they have severe narrowing in their spinal canal, in the central canal. And every time they bend forward or sit down, they're able to open that spinal canal up. And every time they stand up, it's squeezing the spinal canal. Next slide. So this slide is trying to show what I just described. So down at the bottom, in the bottom left, you see a healthy spinal canal. To the immediate right of that, you see in red where the nerves are getting pinched and there's narrowing going on in that central spinal canal, resulting in pain. And then the picture on the right is trying to show one of the nerves getting pinched where the nerves exit on the side. And then, but that same issue can occur not just where the nerves exit, but also in the central canal. So when patients, again, when they bend forward or they sit, they're able to open that space up. Next slide. So the Vertiflex procedure is a nice, relatively simple, minimally invasive procedure that can be done through a very small incision, about the diameter of a nickel or so. And it's a same-day procedure, and it doesn't require the removal of any bone or tissue. There's a very speedy recovery time. You have about 6 weeks of restricted bending, lifting, and twisting. And then after that, we get you into physical therapy. There's a low risk of infection or complications, and it can provide a lot of immediate relief as well as long-term relief. It is FDA approved, and it's been done in more than 10,000 procedures since 2016 when it was first introduced. I have done at least 30 of these cases, and patients report excellent relief and excellent results with them. Next slide. Here, this slide talks about the results. 9 out of 10 patients in a 5-year study reported they were satisfied with this procedure. And I would say that's consistent with what I see in my patient population. Patients report an 85% drop in using opioid medications, which is very important. Opioids create a lot of secondary problems. 81% report an improvement in their physical function, and 75% report a reduction in their leg pain symptoms. So what's remarkable is it's just a small device that requires a small incision that can create such a big impact. And it would not necessarily keep you from having to being able to have a more invasive surgery down the road if that were necessary, but it's a very small procedure, easy, relatively easy technique to do, and you get to go home the same day and not have that much pain going forward. Next slide. So now we're going to talk about neuropathic pain more than mechanical pain. And we're going to talk about spinal cord stimulation, which in the years that I've been doing it, has had the greatest advances of any therapy that we provide to our patients. Next slide. Spinal cord stimulation has been used for over 40 years, and I've been doing this since 2008. And in the last 3 to 5 years, this technology has rapidly advanced. There's a lot of money and research going into this technology. It's working, and it's working better than ever before. A lot of issues that we used to have with it, like not being able to have an MRI once you had this device, has been addressed with new technology so that you now can. It's a non-drug therapy, which is great because drugs all have side effects. And if we can get you off of the drugs and still reduce your pain, it's a win-win. It's also covered by most insurance plans, including Medicare and workers' comp. And yeah, there's very low risk of complications. Next slide. So It also can provide significant long-term relief. On average, patients there you can see go from about an 8.5 down to about a 3. The procedure itself is always remarkable. I always like seeing when the technology is first turned on and seeing the patient's faces afterwards. It's quite remarkable. If it's going to work for a patient, we usually know within a week. So next slide. The ideal candidate for spinal cord stimulator, like I said before, is that type of patient that has neuropathic pain in the low back or the legs. Often that may be associated with prior surgeries and infusions and things like that. And there's just a chronic nerve pain that injections no longer address. Also, patients that have peripheral neuropathy for a variety of different reasons. Patients that have complex regional pain syndrome, which is, or RSD is what it used to be called, where they may have had a trauma or injury to their arm, and then they have continued severe pain in that arm with temperature changes, sweating changes, swelling in the arm where they can't use the hand, or down in the leg, they can't use their foot or their leg anymore. Because the pain is so severe, and anything that touches their leg is really severe. It also can help with people who have peripheral vascular disease. And also it's been shown to help with angina. So actually in other countries, it is used more widely for angina and other types of pain than it is for nerve pain. So the ideal candidate is somebody who's tried all the procedures and is still having significant pain. Next slide. Next slide. So here we're going to watch a little video that explains a little bit about spinal cord stimulation therapy and what to expect.
If you live with chronic pain, you know how all-encompassing it can be. It robs you of the things you love to do. It strains your relationships. It makes even the smallest tasks unbearable. And no matter how many procedures you've had to endure or medications you've been given to try, we know that one-size-fits-all therapies may not give you all the relief you need. Boston Scientific's spinal cord stimulation therapy is different. Spinal cord stimulation, or SCS, is a safe, drug-free, FDA-approved pain management therapy that's clinically proven to help reduce chronic pain. And with Boston Scientific's SCS systems, your therapy can be personalized to your unique needs and preferences. Here's how it works. When you feel pain in your back or leg, for instance, it's because nerves from that part of your body are sending pain signals through your spinal cord to your brain. It happens in a split second, so it feels instant. But the truth is, you don't actually feel pain until your brain receives a pain message from the part of your body that hurts. SCS is designed to interrupt those messages using a small electronic device called a stimulator and thin, flexible leads. Similar to a pacemaker, the stimulator is implanted under the skin where it generates mild pulses. Those pulses travel through the leads to nerves along the spinal cord and interrupt the pain signals en route to the brain. Most SCS systems replace the feeling of pain with something called paresthesia, a kind of soothing sensation that can reassure the patient the therapy is working. Other SCS systems produce no paresthesia. Boston Scientific's SCS systems offer both options, giving you the flexibility to choose from a range of sensations, or, if you prefer, no sensation at all. Boston Scientific's SCS systems can also deliver more than one type of stimulation at the same time, even to multiple areas, giving us a better chance of finding the right treatment for your particular pain. Results of a clinical study show that when patients can choose between multiple therapies in one device, they achieve better overall pain relief. Another great thing about SCS is that you can do a trial with a temporary system first to see how it works for you. Your doctor will position the leads in your back and then connect them to an external stimulator that's worn around your waist. For the next 3 to 7 days, you'll be able to test drive the device, experiencing what SCS feels like as you walk, sit, sleep, and just go about your life. Most people who try a Boston Scientific system feel significant relief. In fact, in a recent clinical study, more than 90% of patients who tried our system decided to go forward with the implant. Over 96% of patients said they would recommend Boston Scientific's SCS systems to other people suffering from chronic pain. In another study, patients with severe back pain reported an average drop in pain score of nearly 6 points, even 2 years after getting their Boston Scientific SCS system. The effective, long-term relief from chronic pain your Boston Scientific SCS system provides can help you reclaim your life and many of the activities you used to enjoy. Talk to your pain doctor about SCS. Learn about the benefits of multiple therapies and personalized pain relief from Boston Scientific. For more information or to find a pain specialist, visit controlyourpain.com.
Next slide, please. So what you saw in that video is they talked about paresthesia versus paresthesia-free therapy. And in the past, it was just paresthesia only, which means you would have a buzzing sensation all the time. What we found with that type of therapy is some patients just could not stand a buzzing sensation all the time. It would annoy them, and the therapy just was not a good fit for them. What has happened in the last 5 years or so is that paresthesia-free treatment has been introduced. So you have the option of not feeling any of that sensation at all. You basically, the device runs in the background, you don't even know it's on, except your pain is lower, which has been an amazing advancement. What another advantage of Boston is some people like both, and they have the ability to do both with this technology. So, and in some situations, you might want to have a little bit of paresthesia to kind of distract you from what you're doing or what that pain area is doing. So basically, there's rapid advancement going on all the time with this therapy, and it's better than it's ever been. And for those patients that have tried it in the past, especially with the paresthesia versions, this is a different technology than what you experienced then, as well as those that have even tried some of the newer ones and, more like 5 years ago. The technology is so rapidly advancing that it's not the same what you had before. So the nice thing about this Boston product is that it's so flexible to address different areas in different ways with chronic pain. Next slide. So the key feature of spinal cord stimulation that makes it different than anything else we do is that you actually get to try it out before you get it implanted. So if there's not many things out there, once you have a surgery, you've had a surgery. Once you've had an injection, you've had an injection, but especially with a surgery, once you've had your surgery, you can't go back and undo the surgery that easily, and your back's never going to be the same. What's nice about a spinal cord stimulator trial is, we put a lead through a needle, pull the needle out, leave the lead behind, attach it to a generator. You get to have that stimulator on for a week to try it out and see if you like it. At the conclusion of that week, we pull out the leads very easily. And if you don't like it, you're not married to the device. If you do like it, then as long as you had at least 50% relief of your pain, you're able to get back to your daily activities. You've had other benefits, and you want to proceed with having it implanted, then you can have it implanted. So it's been it has a great advantage in that you get to try it out before you quote unquote buy it. Next slide. So now we're open for questions. I think I just want to wrap up by saying each of these therapies has the advantage for the right patient at the right time. And that's what we try to do here is provide the right therapy at the right time. If you're just recently injured and you have new sciatica type pain, this is not going to be the treatment option for you. But if you've been dealing with chronic pain issues such as chronic low back pain or chronic neck pain, or if you've had issues where you're bending forward when you're walking and you want to stand tall and straight, but it makes your legs go numb or create a lot of extra pain in your back or your buttock and your legs, and you have relief with sitting, then there's a good treatment option for that. If you've had prior surgery or you've tried a lot of different treatments and you still have sciatica type pain or other pains, then maybe the spinal cord stimulator would be a good treatment option for you. So what we try to focus on is finding the right treatment for the right patient at the right time. All right, I'll open it up for questions.
Thank you, Dr. Anderson. So actually, Lee from Boston Scientific is going to run the Q&A section of this. So introduce Lee to you. It looks like there's a few questions already. So Lee, take it away.
Thank you, Liz. Okay, so I'll just start here from the top. Does the Vertiflex procedure leave a large scar?
No, not at all. The incision is probably about a nickel diameter or length, about an inch. And at most it would be 2 inches if we were doing 2 levels consecutively and the incision joined. But no, it's a very small scar. Typically patients come back about 10 to 14 days after the procedure to have staples removed. And I haven't had any patients complain about the size of the scar.
Thank you. Next question. Will you be able to feel the SCS device when you lay down to sleep? It seems like the battery going dead will be an issue.
So those are great questions. So we typically place the battery or the generator, as it's called, in the love handle area if we implant it. So during the trial, you're going to have it taped to your back, and you might feel it during the trial because it's external to your back. But when it's implanted, we try to put it in the love handle area, so it's below your ribs and above your pelvis, so that you're not laying on it, and it's in a soft, cushiony area. So as long as we're able to do that, which I now pay attention to make sure that is done, I haven't had a lot of complaints about pain when they're laying on it, unless it's, right after surgery and there's still some swelling involved. And as far as the generator, now the generators, you have 2 different types, and I didn't really get into that during today's presentation, but there's 2 different types. You can have what we call a permanent battery or a rechargeable battery. So the rechargeable battery, you can recharge it once a day or once a week, whatever the energy need is for your particular pain. And that type of battery typically lasts a good 10 years or longer. Whereas a non-rechargeable battery typically lasts, in my experience, about 4 to 7 years. At that time, we would make a incision right over the generator. We call it where the generator sits is like a pocket. It's just under the skin. And we remove that generator or pop it out, put on a new one, and just sew you back up. And it's not a big surgery. And at that point, you would get the latest and greatest generator at that time. Most patients elect to have the permanent generator just because they don't want to mess around with recharging it all the time. And in my experience, the patients that do the best with the device are the ones that forget that it's even there.
Thank you. Next question, can SCS be used on the neck and the back at the same time?
So yes, I'm trying to think if I've even had a patient that had both areas covered, but theoretically, yes, they would be tested separately. And we really want to make sure that they had indications in both areas to need both. I have by far most common is stimulation for the low back, buttocks, and legs. But I have implanted a few patients in the neck for more neck and arm symptoms. So, but yes, a patient could have generators for both areas.
Wonderful. And how do these procedures help with chronic neck pain?
So the same way that it helps with low back joint pain, if that is what the cause is, then we can again do the numbing injections or the temporary block injections called medial branch blocks in the neck. Confirm with a pain diary that that is where your pain is originating from, and then go ahead and do radiofrequency ablation next to the little tiny nerve branches that send pain signals from the joints, and give you relief just like we would in the low back. As far as the Vertiflex procedure is only indicated in the low back, in particular from L1 down to the L5 level. The spinal cord stimulator is typically, when it's used in the neck, it would be more for radicular pain or neuropathic pain involving the arm or upper limb. So not just for neck pain.
Okay, thank you. If an RFA procedure was not very effective in one area, say the thoracic area, does that mean that it would not be effective in the cervical region?
No, not at all. Radiofrequency in the thoracic spine, which is a little trickier, just because the nerves are more variable in that area. In the neck, it's very consistently the nerves that we do the radiofrequency ablation procedure on run in a very consistent pattern. Same with the low back. In the thoracic spine, it's very variable, especially in the mid back area. So again, it would just require test injections to see in the neck or in the low back where your pain is and confirm it, and then we could do radiofrequency there.
Wonderful. And would the SCS system interfere with a pacemaker?
No, we haven't had any issues with that. When I first came out into private practice, some facilities required that we have the pacemaker representative come in and what we call audit the pacemaker during the procedure and when we turned on the stimulator. And it never made a single blip or false move. So I have not seen it interfere in any shape or fashion.
Thank you. Can I get an MRI with either of these devices?
Yes. Short answer, yes.
Perfect. So we already discussed that the implanted battery can last up to 10 to 12 years, but the next question is, when is it recharged and how often?
Can you ask that again?
How often do you need to charge the spinal cord stimulator?
So if you have a rechargeable battery, it again depends on how much energy you're using, but most patients just recharge it every day. Like they watch TV, they have it set up and they can recharge it every day for a short period of time.
Thank you. And how long do these procedures take?
So the radiofrequency ablation typically takes 15 minutes. The Vertiflex procedure with the implant, one level takes probably 40 minutes and two levels probably about an hour or so. The spinal cord stimulator trial takes about 15 minutes, and the implant takes about 40 minutes, 45 minutes.
Thank you. Are there any short or long-term restrictions after getting these procedures done?
No, there are more temporary restrictions just because we want things to scar in and scar down. The radiofrequency ablation, basically, once that procedure is done, it's done. It's going to do what it's going to do. So there's nothing you can really do that would alter that. The Vertiflex procedure, no, I can't think of anything that you would be kept from doing. And for the spinal cord stimulator, again, no, once you get past the initial 6 weeks after the procedure, or sometimes a little bit longer if you're really active, you can then resume normal activities.
Wonderful. Next question is, how large is the generator?
So it depends on whether you want a rechargeable or a permanent cell or a permanent battery. So the rechargeable is, do you have any models there, Lee?
I actually do not have a model on me, but what I like to explain is that the rechargeables are about the size of a double stuffed Oreo. So although it may have looked big because I blew up the photo on this slide or on our last slide of it, it's fairly small. And then the non-rechargeable is a bit bigger than that.
Yeah, the non-rechargeable is probably about this size. Oh, I have some pictures. So this is a non-rechargeable and another non-rechargeable. And this is a rechargeable, the smaller one here.
Beautiful.
So yeah,
Very handy.
this is that's a good description. Double stuffed Oreo.
Perfect. And if I've had spine surgery and or a fusion, am I able to get either of these devices?
It depends on what's been done. And in particular, I'm thinking about the Vertiflex procedure. It depends on whether you have a spinous process, which is the bump that you feel in the middle of the back. Sometimes surgeons will remove that. You kind of need that both at the level above and below for this to work. For the spinal cord stimulator, for the most part, yes, unless again, there's been a particular surgery that for whatever reason, it blocks our access into the spinal canal. But usually we can figure out a way to get it to where it needs to go.
Wonderful. Next question is, can you use a spinal cord stimulator for mechanical pain too?
It just doesn't work very well, but you could try it. It tends not to work very well. A lot of patients I've had in the past, before we had the Vertiflex procedure available, I have had some older patients that were not candidates for surgery with their spine surgeon because of complications, medical complications, and their age. So we would try the spinal cord stimulator with them prior to that being available. And we had varying degrees of success. Now, some of those same patients, now that we do have this available, I've gone back and put this in, and it's allowed the spinal cord stimulator to work even better. And they have a lot better outcomes.
Wonderful. What about showering and hot tubbing? Are we able to do that with either of these?
Yes. As long as you get outside the initial post-surgical period, once the wound is healed, yes, as far as I'm aware. Are there any contraindications, Lee, to the spinal cord stimulator with heat?
No.
I'm not aware of any, so no.
Wonderful. And will the spinal cord stimulator or Vertiflex implant interfere with ultrasounds?
So there's different types of ultrasound. There's therapeutic ultrasound used in physical therapy. And then there's ultrasound used for diagnostic reasons, like with radiology. It would only interfere where the device is. So it would block that signal just because it's metal. It'll block the signal of the ultrasound. But outside of that area, it wouldn't interfere. Like, let's say you're doing the ultrasound on the front side of your body. This is implanted on the back side. So it would not interfere with anything they would be trying to look for there.
Okay, thank you. Next question is, can you please confirm that the Vertiflex procedure is not indicated for the cervical spine?
Yes, that is definitely not indicated for the cervical spine. It's just, I mean, you can look at the device. It's a spacer device. It perfectly sits here in this lumbar spine model, but a cervical spine, the spinous process is all slant downward. They're very close together, and that device just, it wouldn't be designed for that. It wouldn't stay in place.
Okay, excellent. Thank you.
So I know that there is one question in the Q&A that asks about cost. So it is so difficult to actually answer that question because every insurance is different based on the diagnosis that you have. And then again, Vertiflex procedures versus stimulator procedures. There's so many variables, it's really difficult to actually give you a range of what that out-of-pocket cost would look like. So my suggestion truly is to come in, have a consultation, make sure it's even something that you're a candidate for. And then we have a billing coordinator that organizes all of that and make sure authorization goes through. And there's a lot of steps that are involved, but we do all of that. And we work with Boston Scientific and we try and make sure that you get the best coverage possible and making sure that it's, the right device for you. So suggestion really truly is to call and make a consultation with us. We do have to kind of wrap it up at this point of the Q&A. Some of the questions are getting really specific and we'd really rather just see you in person and actually be able to answer these questions. So there are, we do have, some people have anonymous and some people have their names, and we can follow up with you to get you scheduled to come in and see Dr. Anderson, or if you're a patient of Dr. Hiros, or either you may have seen one of our physician assistant or nurse practitioners. Well, we can get you scheduled with them to really kind of go over these questions more in detail. So I really appreciate your time this evening. Again, we will be sending out this recording will be on our website, and we will contact you for those questions that we didn't get to answer this evening. Thank you, Dr. Anderson, so much for presenting tonight and taking the time out of your evening to be here for your patients. I hope everybody feels a little bit more educated about options that they have to alleviate their pain. You can definitely feel free to call us during the 8:30 to 5 hours, Monday through Friday, to get scheduled for that appointment. You can also go on our website, spinaldx.com, and request an appointment that way if you'd like, and we can follow up with you. Again, thanks for joining us this evening. We hope you stay safe and healthy and have a great holiday season.
Thank you, everyone. Have a good night.